Moments with Dr. Greta are brought to you by the Ashley Clinic in Chanute, Kansas. Allergies. What you know may not be so. Article from Medscape called Many Popular Beliefs About Allergies Aren't Supported by the Evidence came out in November 2025. There are 4 basic areas: antihistamine use, penicillin allergy, hives that need steroids, and cow milk allergy. Antihistamines. We're still using a lot of the first generation antihistamines like Benadryl, a whole lot more, and we should really be going to the second generation, which is like Claritin, Zyrtec, and Fexofenadine. If you're using the first generation Benadryl and you're just using it several times a day or even several times a week, check with your doctor. You may not be giving the best care and causing some other issues as well. Next, penicillin allergy. If you've given an antibiotic and your child has a rash, you might think, oh, it's a penicillin allergy, and you'll just assume yourself you should just never give the child penicillin again. Well, that's not a good idea. Check with your doctor. Penicillin allergies are really very rare, and usually there's other reasons to think about. Just don't label your child as having a penicillin allergy without knowing all the facts. Third, hives need to have steroid. People go into an emergency room and they'll get a shot or oral steroids. This isn't good for your kids. If you do that over and over again, you are telling your body not to make its own steroid, and then that puts your child at risk for other things. Always tell your doctor when your child's had a steroid boost so that you're sure you're not missing some other issue. And then cow milk allergy, often the lining is harmed enough that it doesn't make an enzyme to break down that lactose. So you think your child will later have a cow milk allergy when it's really lactose intolerance for a short time. So don't just label your child as cow milk allergy. Talk with your doctor. So give that kid a hug.